Yes, the American healthcare system is broken. It's headed for a meltdown. We've got declining quality of care. We've got these rising costs that people can't afford. Companies can't afford them, and individuals can't afford them. Families can't afford them. And then we've got rising numbers of uninsured. And if you put all those things together, what we have is a system that's essentially melting down. There are a number of things that we have to do. First of all, we've got to contain costs. We just can't keep paying the costs that we're paying. Right now, we pay about twice as much as the next highest industrialized country, and our health outcomes are worse. So we've got to squeeze costs out of the system, and there are some obvious ways. Information technology, for example, bringing down the price of prescription drugs, doing more to manage chronic disease, which is the most common kind of disease today. These are all things that we need to do. Getting the uninsured covered so that we don't have all this uncompensated care is another aspect of it. One thing that's a long-term payoff, but that we have to start right now, is wellness programs. We need a national, coherent prevention strategy that's going to be a long-term investment. If we don't do that, obesity is going to reverse longevity in this country. And of course, we talked earlier about tobacco, diabetes, heart disease, high blood pressure. These are all ailments that we can control if we tackle the prevention and health promotion aspects of them. And so those are all ways that we can deal with the healthcare system. Right now, it's very, very fragmented. So you'll have wellness programs at the work site. You'll have the government doing 2 or 3 things. You'll have states doing several things. So we have this fragmentation. We don't have any national system for it. So that's one major problem. Another problem is that the payoff is long-term. So a company may say, well, do I really want to invest a lot of money in keeping my young workers well? Because in 5 years, they're going to be working at another company. Or a congressman will say, well, I'm worried about the budget this year. So I really want to vote for something that's going to be expensive and has a 10-year payout. So it's this long-term investment that's being missed. It's all those things. What we need government and the private sector to come together on this. I do not think government can be the answer to prevention and wellness. But I don't think you can just do it in the private sector either. We need a public-private partnership, some kind of a wellness program that's well-funded, that's sanctioned by Congress, that everybody buys into. And when I say everybody, I mean everybody. I'm talking about the fast food and the processed food industries. I'm talking about educators, because we've got to do something about wellness in the schools. I'm talking about everybody. Yeah, we need to sanction this thing. It needs to be official. It just can't be some casual, some kind of an informal thing where we ask everybody to come to the table. We need something big. One parallel example that some people have talked about is the Federal Reserve. Could we take that kind of an example and that kind of an analogy? Could we do some kind of a Fed for wellness? So that's the kind of thinking that I think is important. Healthcare is a universal right. Yes, I do believe that. But I think we also have personal responsibilities to stay well. It doesn't do to say, I'm 65 years old, and you go into a physician and say, I'm starting Medicare tomorrow, I'm obese and I smoke, now take care of me. We have a personal obligation as well as a right to health care. Well, I think health care, again, is a public-private sort of thing. There's this great ideological argument about the single payer versus, let the marketplace prevail. The answer is in between. Right now in California, they're looking at a plan whereby they would have people be required to buy health insurance. They'd have the health insurance companies stay in the game, but have to insure people and not be able to cherry pick and leave out those with illnesses. They would have the individual corporations be involved in it, and they would have a sense of personal responsibility involved. So if that ever came to pass, that could be a good model for us. Well, I think there are other models in other countries. And I've looked at these models. AARP has looked at these models. The thing is that we are unique. We're unique in terms of our social and our economic systems and how we treat capitalism and how we think about government. But we can learn from other countries. But we have to fashion a unique American answer, I think. The pharmaceutical industry has an important role to play in American health. First of all, this is a life-saving industry. This is the industry that we hope is going to be able to control Alzheimer's and Parkinson's and these other diseases of the elderly. So we are dependent upon the pharmaceutical industry. But at the same time, prescription drugs cost too much in this country. And we have to really move to generics. We have to get costs so that they're affordable for people. We have to figure out a way so that the pharmaceutical companies can make a reasonable profit and people can afford their drugs. And right now, we're not there.